This is Francie Sharp. I was a Boys Fellow I finished in 1998. We're here with Dr. Milan Stevanovic, who has been the director of the Boys Hand Fellowship since 2009. He's had a 16-year tenure as our director of the fellowship, and he's been at USC since 1993.
Sorry.
Can you tell us a little bit about the Boys Fellowship, when it started, who were the original founders other than Dr. Boys, and then a little bit about who was present at the office when you came in 1982, 83, 81 to train, and what your experience was like in the Boys office?
Fellowship started 1951 when Dr. Boyce came from San Francisco to USC and found a private office. And later on, he joined the USC program. He was working with Dr. Bunnell, who is the father of cancer surgery, together with Himmler. Dr. Bunnell was first president of American Society, and Dr. Boyce was first secretary of Cancer Society.
And Dr. Bunnell was up in Stanford.
Yes,
and
San Francisco.
And then I understand that the story is that two big
giants cannot
two giants cannot occupy the same space.
The same space. I think it was a good that happened, because USC got one of the best and smartest guy. Dr. Boyce actually told me after I came as a fellow here that he finished his college at Stanford. After that, he finished his medical school at Stanford and wanted to be a neurosurgeon. And he applied for a neurosurgery Harvard program and got the Cushing program that time. So he told me he's chairman of the general surgery, said, I don't think so, Joe, is your smart idea. Cushing is a very difficult guy. And Dr. Boyce told me the worst time in his life was first year of Cushing. So he was thinking to, stop being a physician anymore. And the chairman at general surgery at Stanford say, Joe, come back. I'll take you as a resident. And he finished general surgery, not neurosurgery at Stanford. And I know when he moved his office to USC, I was at USC that time, he said, please take people from both specialty, plastic surgery, orthopedic surgery, and general surgery. And we did, thanks to Dr. Boyce, many general surgeons got fellowship with us. So he was an amazing guy. I applied to 6 programs in the United States, and I got in 5 programs. One was Dr. Boyce program. He wrote me a letter, said, I just retired. I'll tell Dr. Stark to take you because we never had anybody from South Europe to train our office. He had at that time probably about more than 20 people from Europe, England, France, Italy, Turkey. They trained here. The oldest program in surgery was 6 months at that time. Later on, Carol extended it to 1 year. And when I came in office, they had 4 fellows, including me, 5.
Who were the founding members besides Dr. Boyce of the fellowship program, if you know?
Yes, Dr. Wilson was there, but I never met him, and he left already when I came. Was Dr. Stark, Dr. Ashworth, Norman Zemel, Rickard, and Dale Anderson. Tom Rickard and Dale Anderson. So it was a big group. It was a private group, take care of very famous people in LA, a lot of, actors, athletes. Dr. Stark actually one who treated Tommy John, and he's the one who designed the procedure and did the job. But Tommy John was the patient of Dr. Job. So in the paper they published later on is Job Stark, reconstruction of the medial collateral ligament of the elbow, which is today one of the very known procedures, but we contribute to that. They also had a couple amazing fellows. One of them developed arthroscopy in this country, Laney Johnson. He had a co-fellow from Japan who went to Japanese Orthopedic Society and met there Watanabe, who designed a scope, and just fell in love with that. So every single book and technique and everything is Elaine Johnson. And the guy who was from France, who developed reverse prosthesis for the shoulder, was
He was a
also
boys'
he
fellow.
was Boy's fellow.
Oh.
So yeah, very. I think probably over 150 chiefs of the hand service around the world, including Japan, China, South America, Europe, train in this office.
And then we also have lots of members of who were president of the Hand Society over the past.
Yes, six
Yes.
president of American Hand Society trained in this office. The first one was Lee Milford, who worked in the famous Campbell Clinic in Tennessee, Memphis. After that, Dick Smith, who was for 30 years chief of the hand surgery at Harvard. Ronald Lynchai at the Mayo Clinic, also 30 years. Dr. Ashworth and Julio Telesnik. And Dr. Boyce was, I think, second or third president of American Hand Society. He was first secretary with the final president of the secretary.
And also, they like to place their fellows in academic spots, and so
Yes,
had a wide reach around the nation.
Yes, that was a very smart decision by Dr. Boyce to control every single university that he could and have people, very, very capable people to run the services in these universities. I know Dick Smith was amazing guy. Ron Lynchai, he did all classification of VCDC and so on. So I had opportunity to spend 4 weeks with Dr. Lynchai. Dr. Stark sent me to the Mayo Clinic to spend there. And yeah, it was an amazing experience that you could get in office.
Sounds like Dr. Boyce had a bit of a power complex.
No, I think he was a great guy. I was lucky to listen to his talks. I never saw him operated, but Dr. Stark told me he was like the best piano player that you can listen. That's how he did the surgery. He had amazing, talks. Every week he would come and give 1 or 2 talks. He is one who rewrote 4 times Bonnell book of hand surgery. And I think he's, responsible for development as much probably as Bonnell or anybody else in the world. I'm so proud that I was able to get that fellowship. You cannot believe it. Yeah.
Well, the fellowship is extremely proud of you.
Oh.
You've been a remarkable mentor to so many people, and you've pioneered so many different techniques with reconstruction and free tissue transfer and functional free tissue transfer. I think most of us feel very grateful for having had the opportunity to work with you, and we look at you as our master pianist who performs so beautifully in the operating room.
Yeah, it's no bigger pleasure than work with young people, try to learn, what you know. Not everybody knows everything, but I think it's a responsibility of human being that if they learn something to transfer to their students. And if the students don't become better than you as a teacher, that, in my opinion, you are a very bad teacher. So the students must be much better than the teacher. That's how all pyramids start. So I was lucky all this time here. We had a 99.9% the best residents that we can get as a fellow. So proud of all of you.
I'm Amber Elise, and I was a hand surgery fellow at the Boyce program from 2014 to 2015. Very, very grateful to have this position, courtesy of Dr. Sharp, who was actually my mentor and who helped me get the fellowship. And I was really delighted and lucky to train with you, Dr. Stevanovic. But I was hoping that you could tell us a little bit more about your pathway to medicine, how you decided to be a doctor and how you decided to be a surgeon.
It's interesting. In high school, I was a major in math, and my math teacher had a more influence on me than my parents. So I told him, in our family, Nikola Tesla is the smartest Serbian scientist. I was going to engineering school, and he said, no, I wanted to go to medical school. And that's how I decided to change and go to the medical school. And when I was in medical school, just first year, the first heart transplant was done by Christian Barnard in Groote Schuur in South Africa. And I said, maybe I should do, cardiac transplant. It's probably a very challenging position. But after I finished medical school, I applied to the orthopedic surgery. And the reason why I was an athlete, I had several injuries, small injuries, and was treated in an orthopedic hospital like there. And I decided to go there. And I was lucky to be one of the 4 fellow residents that were in that program. So during my time, the majority of the patients were hand injuries. We had like 2,500 distal radius fracture a year, and we operate probably half of them. We didn't have a plate and screws, but we have nails and K-wires and so on. I also saw a lot of compartment syndrome that time, and did release a lot of compartment syndrome and save many extremities that time. So we had also a very famous chairman, Dr. Bombashirovich, who was member of the Science Academy. He had a lot of friends. And I remember one time he brought Dr. Scaglietti from Florence to show us flexor origin slide procedure. And my first patient with Dr. Ashworth at General Hospital was a patient with CP that needed flexor origin slide. And Dr. Ashworth said, Milan, you are going to see today a procedure that probably never heard about them. I said, I don't, maybe not. Can you tell me what is? And he said, that's a patient with spastic palsy and has a need a flexor origin slide. And I said, Dr. Ashworth, I assisted 4 of this with Dr. Scaglietti from Italy. And he said, my God, I went there to learn about that. So, it's very important that you bring good speakers for the grand rounds and so on, because, for example, I learned from Eduardo Zencoli how to do latissimus dorsi rotation flap for elbow flexion, which, as you know, is a very nice procedure. So lucky to learn that. So after I we have a 1-year internship general surgery, and after that 5 years orthopedic surgery, and I applied for the hand surgery fellowship because I had the most experience as a resident to 6 programs, and I was accepted in 5. On this 5, the best one was, in my opinion, Dr. Joseph Boy's program, because Boy's had at that time rewritten a Bonnell book. It was the only book that I had that time as a resident.
And after you finished the Boy's Fellowship, what did you do after that?
After I finished Boy's Fellowship, I took Dr. Ashworth's advice that I should do microsurgery fellowship. And I tried to do in our orthopedic hospital office, but they didn't really have experience too much. They tried to do, but was not many trauma patients in our office here in South Hope Street, an orthopedic hospital. So Stark was very nice. He said, you have to let me know how many years you can take. And I told him I asked medical school, and he said up to 2 years. So he said, you are going first to Duke, and if you don't like there, I think you should go to Hopkins or go with Bunkie. So I was lucky to get to Duke. At that time, they had experience with 700 replants. And today, Duke is a place that I have the highest, respect in the world.
And after you finished at Duke, then what did you do next?
Oh, I went to become assistant professor and chief of the hand surgery in my university hospital. My hospital was built 1905. So it's an old hospital. It's a hospital where first blood transfusion was done in the world, and the first x-rays was done in 1905. That's the old hospital, treated a lot of difficult injuries, and it was mainly trauma, like County. We did tall joints and reconstructions, but many, trauma patients.
And how many years were you there?
I was there from 84 to 1992. And I came to the United States, took all these exams. In 93, started to work at USC.
What was your decision to come back to the U.S.?
It was very difficult. If somebody told me I'll ever practice medicine in the United States, I would say probably something wrong with you. We had a civil war, unfortunately, so many wars as you can see now in Europe, and I didn't want to be part of I didn't feel, that's place for me to stay longer. And I'm very thankful to what United States did and helped me, to grow to this level. Probably no country in the world would allow you to do that. And I'm, really, really thankful. Lucky.
Can you tell us about bringing microsurgery back to your home country?
When I came there, I was lucky to get a microscope. Was East Germany microscope, not Zeiss. Zeiss came from the same family, but in West Germany. And I had a very nice CFO of the hospital who might treated several family members and so on. And I talked to him, and he said how much it cost. Well, I said it's about 200,000 Deutschmarks. That remember that Deutschmark at that time was like $2.5, $3. Very expensive. So he bought me 2 microscopes. And good things happened to me. One of the guys to work as a carpenter in factory was working, doing some work for his director and cut a thumb. And I was able to put that thumb back, and he built for me, microsurgery lab with a microscope and everything, and a place for rats. So that really improved. And they also allow me to hire about 4 fellows. I did hire 6. So we were working all day, all night. If you are not working, doing replant and flaps, so on, they were working in lab. So it was a very nice, well done lab.
Did you have any jobs when you were younger that you feel like helped you develop a skill set or an aptitude for surgery?
Yes. When I was in high school, I lived in the building where a clockmaker was in the ground floor. So I used to come there, and we had nice relationships. And he said, how about to help me? I said, how you mean? If you can take these big clocks, this assembly clean and put back. And they had the pickups and so on. So I really, making extra money to buy tickets for the movie or a theater or tickets for the soccer game. So that's how I make my money there. It was a very good experience. So I think it's very important, any type of experience that you can have before you go to further education.
Are those things that you look for in the fellows that you selected for the program?
I think this dexterity is very important. Sometimes people ask me how this guy is not good when he finished the best program in the United States or in this state of California. First, you have to have a love to do something. And I think if you like your job, you are going to succeed. And if you work hard, there is no question about that, in my opinion. So I think that's very, very important, that you love your job. Be nice to the patients. Nobody come to see how nice looking you are, how smart you are. People have, problems. Somebody living alone, so they come to just talk to you. Sometimes patients say, cannot come anymore. I said, you can come every time, but there is really nothing that we can do more for you because you are doing fine. And I think that honesty is the most important. Be honest with the patient. Don't promise anything more than you think will be. Always promise less. Tell patient, this is what we can to do for you. And also never tell what other people did. That's my advice. You were not there. You don't know what's happened. Maybe patient didn't take advice seriously from the doctor took the cast earlier, or didn't want to have a surgery. That's how it is.
Did you do toe transfers when you were back in your home country?
Oh yeah. When I started, the microsurgery was not there, and I had 2 patients for the toe transplant, and the resident presented their patients for pass on in the morning, and one my attending, went across the street to talk to this. So we had a doctor who was a neurologist. He said, I think that Stevanovic is not doing well. He said, why? He said he's planning to do 2 toe transfers for 2 patients. What do you think about that? I think I never heard about that. He said, why you don't tell him you are, his professor? He said, I really don't want. I did it one Monday, one Thursday, both survived. I waited for 2 weeks, and after 2 weeks, I brought them for the grand rounds, and the residents was presenting. This is 2 great toe transfers done in Serbia. Both patients were doing well, and showed the picture, X-rays. But I had both patients in front of the conference room, so I brought them to this professor and said, "What do you think about this?" So he was surprised. He just didn't see anything.
It's wonderful. Can you tell us a little bit about your early practice at USC after you came back to the US?
It was tough. No, I practiced with my late friend Randy Sherman, and 2 of us who were doing well. He was a plastic, I was orthopedic. I said, both of us are going to lose if we, get in an argument between each other. How about to do it together? And he was very nice, so we did it together. I covered plastic surgery, free flops. He covered hand. He wanted to do the hand, so on. And fortunately, he died so early in his life last year in a airplane accident. It's just tragic, So the fellows were very nice, and 99% of the fellows were, first class. That I would always be happy to do surgery on me if I need something. And I share with them everything. That's how we describe the medial chimeric flap. I was telling fellow how I cannot get perfusion on the medial side on the cadavers, and Chidester, Jerry, told me, if you have a money, Dr. Stevanovic, you can show. I said, money is not a problem. So we published that, and it was so nice to see many people at flap course told me they did our flap for the covering of the genital area patient with cancer. They didn't need to do the free flap and so on. Yeah, I mean, I grew up with you guys. You did all the work. I just baptized the cases, what they say. But I'm so proud of all of you. It's just so nice.
We are
so nice.
Deeply grateful.
Thank you
for everything that you gave us and for the legacy and history of so much knowledge that passed from your mentors through you to us. So thank you.
You are just beginning, is now everything on Luke Nicholson. He is one now who has to run, but I don't have any doubt that he will be so successful, because he has been successful so far, and he and Ali Azad and Erin Meisel and Nina is in Children's Hospital. So I think we have a good pathology and a good program.
Yeah.
So please stay close with the program in your future. Just want to invite you to give a talk and so on, support us.
Can you tell us about the patient that you transferred 6 toes and what happened for that patient and for that case presentation?
Yeah, that's a 52 years old lady who suffered burn injury when her car, went in flame, and she lost skin from the face, from the chest, from the forearms, lost all the fingers, including the thumbs, had the only normal skin on the palmar side, and She went to 4 different institutions before she saw me: Hopkins, Harvard, the Mayo Clinic, Pittsburgh, and everybody told her to have a double hand transplant from the cadaver. And she asked me, I said, if you want to live only 10 years more, that's probably the best procedure for you. But if you want to live 1 year more, I don't think so. It's good. She said, well, what you recommend? I said, I recommend a 6-toe transfer, 3 from right foot to right hand and 3 from left foot to left hand. And she said, how many 3 toes you did so far? I said 0. She said, oh, I don't want to be your, guinea pig. I said, yeah, but I did over 100 toes with a second toe, majority great toe. And she said, can you show me some? And I said, someone from the probably 20 years earlier meeting. And she said, I want to do that. So we are, the first in the world that did a 6-toe transfer in 2 procedures, 2 surgeries. One took 15 hours, one 16 hours, but very successful. And she was able after 3 years, first time to, write, type, cook, and everything. Had the 2 kids that finished USC, so she's very proud of USC. So, it's a great patient, a great family.
And you won an award for this case. Can you
It
tell us about
was awarded as the best case for 2021 in the United States. So probably very difficult to get to that award, but I'm proud that it is a part of USC program.
So my name is Luke Nicholson. I had the privilege of training under Dr. Stevanovic as a resident, and then followed his footsteps under his guidance by going to Duke for fellowship. And then I was lucky enough to come back, and I'm very lucky to be in a position to succeed him as the fellowship director for the boys program. Dr. Stevanovic, it's been said by multiple people to me that you have 2 children. One of them is your incredible daughter, Marta, and the other one is the boys fellowship. What does that mean to you?
Mean everything, feel like Boise is a home where I live and work and so on. And I can tell you, we are so lucky to have you to be a director of the Boys Fellowship Program, because I know you will be so successful and you are going to keep the high standard of this fellowship that can be achieved in this country.
One of the things that I've been particularly impressed watching you do is preserve the legacy of the people who have preceded you. Why is that such an important thing to you?
Well, it is important because you are not good son if you don't respect your parents. So I learn everything from these people, and I owe them everything. Like, it's not only boys, members of the staff when I was a fellow, but also I went to Duke and trained as a microsurgeon there with Jim Urbaniak, who was biggest teacher that I ever had in my life, who inspired me to do more and more and more, and be always honest to what you are doing, and try, when you are publishing, don't publish anything which is not true. So I work hard and live with friends. That's why we have so many friends in every single program. When we send our residents, they are accepted as fellows, as you know.
Another important person from Duke that I hear you talk of a lot is Joe Slade.
Yeah, as fortunate, he was a chief resident when I was a fellow there. 2 of them from that program were my younger brother, Scott Levin. He was a 3rd-year resident when I was a fellow, and Joe Slade. Joe Slade was so talented. He is the first in the world who teach us how to fix the scaphoid with a screw. He is the first in the world who found out how we can do destruction of the PIP joint, dynamic destruction after injury. And he was a double board in plastic surgery and orthopedic surgery, and he was a chief at Yale unfortunately died. He and I have been friends for a long, long time.
You mentioned Dr. Levin. I know he has meant a lot to you and continues to do so. Can you tell us a little bit more about him?
Is one of the best residents that Duke ever heard. Nobody achieved as much as he did. Even Duke has so many Germans from the United States, from the Vanderbilt to other programs, Harvard and so on. But Scott Levin was an amazing guy. He worked so hard all the time. He is the first who did a double arm transplant on cadaver and the kids. He did it just recently, again, double arm transplant. He worked so hard. He was also double boarded in plastic and orthopedic surgery. And I have never, ever seen a person who worked so hard as he did. And he always has a good heart trying to help the residents, his residents, to put them on the right institutions and support them all the time. So he's a real great teacher that you can learn a lot from him.
So speaking of mentorship, the Hand Society did a piece a couple of years ago. I don't know if you saw it, where they asked society members to submit a video where they asked people to talk about mentorship and mentors that they've had. And your name came up in an incredible number of times, more than anybody. And
oh my God.
I don't think that you quantitatively trained more fellows than some other people out there, but I think the impact that you had on people was profound.
Try to treat every fellow like I would treat my family. So sometimes I am loud and people think, I'm yelling them, so on. But I really worry about everyone like I worry about my family, close family. And I want everybody to have a successful life like I had one. I cannot say anything. If I ever start again my career, it will be probably the same. I wouldn't change. That's how lucky I am.
Where did you learn that?
All these years, looking at it, I had great teachers all my life, from the high school math teacher and my German orthopedic surgery, Dr. Bumashirevich, Professor Bumashirevich, and later on Stark and Ashworth, and Dr. Boyce also talked to me many times. I used to visit him every time when I came to this country in San Diego. And Jim Urbaniak had an amazing, input.
You've also shared stories about your father.
Yeah, my father had a difficult life. He graduated in 1941 in university in Zagreb military school, and he was with three Jewish guys, roommates, and all four of them were sent to Mauthausen. He spent 5 years there in concentration camp, survived that. Of his three friends, one survived, and other two were killed when they tried to escape. And after that, the communists want to give him a job, but to become a member of the Communist Party, he didn't want that, because my grandfather, who was American citizen, went to fight Turks at the Balkan War and become like a type of national hero. And the king of Yugoslavia gave his 4 sons, one of them was my father, scholarship. So my father had a king scholarship from the elementary school to high school, later on. So, yeah, it was a tough life there.
So nowadays, a lot has changed in hand surgery since you started.
Oh, absolutely. The microsurgery is practically, must to do. And it's like having a sports medicine guy who doesn't do arthroscopy. You cannot imagine that. Second thing, so we have more experience now. Was unthinkable in my time when I was a fellow to do great toe transfer, second toe transfer, free functional muscle transfer. Just soft tissue coverage was just beginning, 73. The first free flop was done by Roland Daniel in Australia. So yeah, now we incorporate that in our program. We have microscopes. You even brought a microscope in county morgue there where they can practice and so on. We have labs. We have instructors that we pay them. And our fellows go for the whole week at the microsurgery centers in United States. The question is whether we should have one with us. Is a lot of money to pay, so I think it's cheaper what we do. Send them there and they practice. The nerve surgery is much different than when I was there. And Amber knows very well, doing all the time that. We take care of more difficult injuries than we did before, more successfully. So we'll be there one day. I don't know whether we'll be ever able, but I think we'll be able from cadaver to, conquer this rejection problem. But I'm sure in the future, I'm not be alive that time, but I'm happy that other people benefit from that.
Specific to the fellowship, we've heard a lot about the history of the fellowship. We know what you've done for it. What hopes and dreams do you have for the Joseph Boyce Fellowship?
Oh, I don't have any doubt they will be leading a hand fellowship in the United States, having you as a director and all people that are with you there, Ali Azad and Erin Meisel and Nina, and I hope you are going to have some more people that, more people get better, group of the patients that you guys can. And you can see now how many great fellows candidates we have. It's just so heartbreaking to see how you cannot take 10 of them, not only 2 of them. So
I've seen you, and as a group, I think those of us who work with you have seen you give hundreds of talks at this point in time, and I've seen you end every single talk with one slide, and it's about never giving up. And there's a picture of an animal inside of another animal's mouth getting eaten, holding onto that animal's neck, and then they never give up. And I will say that I continue, as I get further in my career, I learn more and more how important that is.
I think it's important, don't try to say we can't, start to think about that, read, to talk to your colleagues who have more experience about that, bring the speakers from the field that we are not covering well, that we can learn more from them, and I think it's so much important to publish and to present, because you can be the smartest person in the world if you don't present and you don't publish. It is really not valid for the program. So it's not, publish or perish, but it is important that everybody know what are our results. And we have a lot of good results to show.